Hello, I am KIKU Sharda. To clear our doubts and raise awareness about COPD, let's invite a respiratory specialist. Let's get started. Doctor, help us understand COPD and its symptoms.
What is COPD? And, understanding COPD is very important because it's the one of the leading causes of the death in ICC. Fourth leading cause. Mortality is increasing day by day, almost 7.4 in India, and it is irreversible. Whatever damage has happened. So COPD full form is Chronic Obstructive Pulmonary Disorder. It consists of three variants: chronic bronchitis, asthma, emphysema. And it's a disease of airways and alveoli. So airways leads to excessive mucus production and obstruction. Alveoli get destroyed. That's why it is very dangerous. And one should understand it and try to prevent it. There is no cure. Prevent it as early as possible. It's very important to recognize the symptoms of COPD because it is neglected and the approach to the doctor is very late. So the most important symptom is cough, which is always very slow to begin with. Early morning cough is more important and it is repeated every month. Patient suffers from the cough for almost 10-15 days, also known as smoker's cough. Second thing is breathlessness, which is also very gradual. Day by day it increases, and so the patient gets adapted to that breathlessness. So if the patient approaches during early stages, when there is chest tightness, repeated infections, and then cough, breathlessness, the disease can be almost stopped and he will be well. The patient, you can say, can lead normal life. But unfortunately, patients approach at a very later stage where the lungs get totally destroyed, and then he has to put them on, and doctor has to use oxygen or ventilators even at home. The patient's life will be very debilitating, like he cannot do his normal activities. So the recognition of symptoms at a very early stage is done by pulmonologist, and approach to the pulmonologist is very important.
What are the causes of COPD and can COPD be cured?
The causes of COPD is really important. One should know it. The most common cause is smoking, air pollution, and the reason for air pollution, all of you know, so many reasons: vehicle pollution, then burning of newspapers and wood, etc. Then in winter season, it gets accumulated, smog is there. Then third important cause is repeated airway infections, respiratory tract infections, certain autoimmune disorders. They're also responsible for COPD. Again, the reason should be clearly diagnosed by pulmonologist, and according to the reason one should be treated. And here one important thing is prevention. So smoking can be prevented, proper treatment and then counseling and certain treatments can prevent smoking aspect so that we can stop COPD.
Doctor, share some tips on COPD management or treatment.
Now the management part of COPD is very important. First of all, one should know how much the portion of the lungs are permanently damaged and how much portion is still normal and active. Now this can be done by using the pulmonary function test. So this can be done easily by pulmonologist, and accordingly if the patient approaches in the initial stages, that's what I'm insisting on, initial stages, it really can be totally controlled. But in case the damage is too much, although we give treatment, there is excellent treatment for COPD, but the damaged portion cannot be reverted back. That one should remember. And then if it is really 80% of the lungs are damaged, one has to use oxygen cylinders or ventilators. That remains a final treatment, and patients should understand they should not approach at a later stage. So the management depends on what stage the patient approaches the doctor. Thank you.
Thank you, doctor, for your time and detailed explanation. I urge everyone to be aware of this issue and take care. Thank you for listening.